So I'm going to talk about health, beginning with 4 different definitions of health. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. That was quoted by the World Health Organization in 1948. So to start with the pros and cons, the pros of this definition is it takes a holistic approach to health as it discusses the physical, mental, and social well-being of health. So by doing that, it goes beyond the biomedical approach of health. However, there are some cons to this definition as well, as the word complete suggests perfect health, which is nearly impossible to achieve in reality, which I've also stated. It's really hard to be absent of all disease or infirmity, so that definition isn't super applicable in real world circumstances. Additionally, well-being is hard to measure, so this overall definition is pretty vague and broad. This second definition is in French, but the translation is that, and in the sentence before it says, to be healthy is not only to be normal in a given situation, but also to be normative in this situation and in other possible situations. So what is quoted here is health is the possibility of going beyond the norm that defines the momentary normal, the possibility of tolerating violations of the usual norm and instituting new norms in new situations. And that was quoted in 1966. So some pros: this redefines what is the norm for health and designates outcomes as good and bad. However, the cons is I find this definition a little philosophical and difficult to understand for the average person. So I would put that as a drawback to this definition. The third definition is a state characterized by anatomic, physiologic, and psychologic integrity, the ability to perform personally valued family, work, and community roles, and the ability to deal with physical, biologic, psychologic, and social stress. That's by J. Stokes in 1982. So the pros is that this definition expands on the initial definition by the World Health Organization, being more specific, which is needed after that broad overview of health. Additionally, it does have some cons because health is not simply a state. As they identify it here, they say it is a state characterized by etc. It is rather a process. A lot of people describe health as dynamic in terms of health's resiliency and such. So I think a con there would be describing it as just a state when it is a little bit more than that. The fourth definition is the extent to which an individual or group is able to realize aspirations and satisfy needs, and to change or cope with the environment. Health is a resource for everyday life, not the objective of living. It is a positive concept, emphasizing social and personal resources, as well as physical capacities. This is another definition by the World Health Organization. That is in 1984. So I think some pros of this definition is that I enjoy the wording of social and personal resources, as I feel that this acknowledges the inequalities, as it says, emphasizing social and personal resources as well as physical capacities, which really touches on that socioeconomic aspect that contributes to health and inequalities, which is central to health. It is also more specific from the initial definition from the World Health Organization, and it does not use words like complete, which is a lot better for the overall definition of health. However, I think a con is it describes health as a resource, and I think health can be defined as so many other things, as we can even see in the last definition. It was described as a state, but after doing research, some scientists prefer the term process, and here it has the term resource. So I think it'd be beneficial to include the multiple definitions of health in the definition. So what affects health? There is the wealth health gradient, as we can see in the photo I've taken from the slides in class. There is a clear gradient from the poorest members of a country to the richest members of a country. The under 5 mortality rate by level of household wealth. So mortality rate decreases a lot for the rich populations and increases a lot for the poor populations for each country. And we can see there are many trends that point to this, that those with a higher income and wealth have better health overall. Additionally, there are racial disparities. One example in class was the racial disparities in infant mortality. As we can see, the 3 lowest were white, Asian, and Hispanic. However, the Black or African American population is double that of the white and Hispanic population, and the American Indian is also significantly higher than the 3 other categories. So you can see there are large disparities based on race and health. Secondly, there are a lot of social and ecological impacts that impact health. First, there's individual behavior, which we will get more to in following slides, such as exercise, nutrition, habits. Additionally, there are social, family, and community networks. There are living and working conditions. For example, living conditions, they have seen that people living in certain housing that's not as clean experience higher asthma rates from the dust in these housing complexes. So that would be an impact on health based on where someone is living. And additionally, there are working conditions. In my last class, we learned a lot about working conditions in garment factories and learned about the Rana Plaza disaster. So that would show how different working conditions can impact your health. Lastly, there are broad social, economic, cultural, health, and environmental conditions and policies at all levels that impact health. So, why are some people healthier than others? There are many determinants of health that we will get into later that determine why some people are healthier. And the main categories are social determinants, economical determinants, physical determinants, and individual characteristics and behaviors. You can see I've attached a map showing the healthiest places to live in the world based on color. So we can see health is truly determined by your surroundings, which often is also involved with social and economical elements and physical environmental elements. So we can see that Spain is rated as the healthiest place to live, and America is a little bit behind some other countries, being a light green color. So what are the determinants of health? There are socioeconomic determinants of health. So as I touched on earlier, the higher an individual's income, the better their health. This also holds true for social status. The higher a person's social status, the better their health. Additionally, education also yields this trend. The higher levels of education an individual has, the better their health is. Also, social support networks are also crucial to a person's health. Culture also can influence a person's health. Also, access to health services and the health services available to a person really influences their health and their ability to heal in difficult times. Lastly, food security also strongly impacts an individual's health. There are also physical environment determinants of health. So this would include anything from safe water to clean air to a healthy workplace to a safe house, as I touched upon earlier. Additionally, there is working conditions, as I touched on with the Rana Plaza crisis. Lastly, there are individual characteristics and behaviors that determine health, some of these being genetics. Then there are certain behaviors like nutrition, exercise, smoking, drinking, and stress. The better the nutrition, the more you exercise, the better your health. The less you smoke, drink, or stress, the better your health as well. Lastly, another individual characteristic that determines health is gender. For instance, male populations are twice as likely to have a heart attack as female populations. So we can see there are certain gender differences that determine your health. Here is another visual breaking down some determinants of health. As we can see, there's economic stability, so your employment, income, expenses, debt, medical bills, and support. There is your neighborhood and physical environment, your housing, your transportation, parks, playgrounds, walkability, your zip code, geography, which was also shown in the map earlier. Then there's your education, which is your literacy, language, early childhood education, vocational training, higher education. There is food, which is your food security, your access to healthy options for food. Then there is community safety and social context, your social integration, your support systems, which I touched upon, your community engagement, your stress, your exposure to violence and trauma, and your justice policies. Sorry. Lastly, I have your healthcare systems. That would be your health coverage, your primary care, your access to culturally appropriate and respectful care, and your quality of care overall. So all these determinants ultimately determine your health and well-being, which is your mortality, morbidity, life expectancy, healthcare expenditures, health status, and limitations. So how can we determine if someone is truly healthy or not? As we can see through the many definitions, they often boil down to a person free of physiological, mental, and biological disorders or disturbances, which in order to determine that someone is healthy, their mental, social, physiological, and physical state must be fit. So some simple ways to measure if someone is healthy would be their waist circumference, hydration, blood pressure, vegetable intake, cholesterol levels, blood sugar level, their time spent exercising, and their hours of sleep. However, as we can see, there are ultimately many different definitions of health. So what one considers healthy may vary across different cultures and societies. And then that's my works cited. Thank you.